Hello, everyone. It's just amazing to have you here. My name is Hamed Ektiari. I'm the chair of the Regional Council, and I'm really excited to have another quarterly Regional Council meetings today. And we have new members, and we have some kind of exciting activities to do today in our agenda. But we start with our president to say hello and kind of welcome everybody, and then we move forward with the agenda.
Hi. So I'm starting to say the outgoing president, because very soon we'll have a new president, Hamad El Kaferi, after Marrakesh. But welcome everyone. It is really lovely to see so many new faces here, and the family, the community for regional council, regional representative is really very impressive, and in the way it's forming, the way it's deciding, and leading things globally. And I wish you all, really, it's such a unique opportunity. I wish you that, you will gain out of this, not necessarily for the sake of ISAM, but for the sake of yourselves, understanding, what global addiction medicine is. I remember one of my mentors telling me there's a difference between being international and understanding what internationalization is all about. And 10 years down the line, I think I'm starting to understand, but this is internationalization in practice. So yeah, looking forward for the hour's meeting. Thank you, Hamid.
Thank you very much, Alex. And as Alex mentioned that he's basically going to hand over the presidency to the next president, Hamad Al-Ghafri. We are also going to have a new president-elect, and Mark is going to be officially the next president-elect from ISAM Marrakesh in November. So Mark, do you want to say hello?
Yes, hello everyone. I'm really delighted to be a part of the ISAM family and organization, and look forward to years to come. I think that the organization has done a lot of wonderful things, and I think it's continuing on an upward trajectory. So I'm glad to be a part of it.
Thank you very much, Mark. And now we have also Dr. Greg Bond, who is our senior advisor here in the Regional Council. Greg, do you want to say hello?
Yes, hello everybody, and it's great to see everybody after all these years of Regional Council. And we got a lot of new faces. I'd like everybody to be introduced. Maybe Hamed, I see some new faces that I'm not familiar with, so maybe we could go around.
Absolutely. And we have kind of few new representatives here today that we'll start with them to introduce themselves. And then we go around the table and kind of ask others to introduce themselves. So Carol is going to be the next US representative in the Regional Council. Carol, do you want to say hello?
Hi, everyone. I'm very excited to be in this new role and to represent the US to the Regional Council. Should I say who I am, or just say hello? Or
absolutely, go ahead.
All right, anyway, I'm from New York. I'm an addiction psychiatrist at Weill Cornell Medical College. I'm boarded in both addiction psychiatry and addiction medicine, and I'm on the faculties of both the departments of psychiatry and the Department of Medicine. And my special interest is trauma, and I'll be presenting a symposium along with Shalini and Olina Zabenko at Marrakesh on PTSD and SUD. And I'm also the co-chair with Shalini of the PTSD SUD work group. So we're very excited to bring that dimension to ISAM.
Thank you very much, Carol. And we are also going to have Dr. Rania Mamdouh from Egypt to be representing North and also West Africa. Rania, do you want to say hello?
Hello, dear colleagues in ISAM Regional Board. And hello, Dr. Hamed, Professor Alex, Professor Potenza, Professor Bond. Hello, my dear colleagues from all other regions. My name is Rania Mamdouh. I'm an associate professor of psychiatry in the addiction psychiatry unit of Cairo University, Egypt. And I'm so pleased and have the honor to present the North and West Africa for the next 3 years in the ISAM.
Thank you very much, Rania. It's great to have you here. We are really excited to have your active role here in the ISAM. We have Dave Martel, who is going to be representing Canada in the council.
Good morning, everyone. As Hamed said, I'm Dave Martel. I actually live in a small community on the eastern coast of Canada, in a province called Nova Scotia, a province of 1 million people. For those of you who don't know, Canada is a country of 40 million people, and it is massive. We have 6 time zones. And just like these ISAM exams, I think we struggle to have people all on at the same time in various parts of their day. So I appreciate people who are here very late at night and very early in the morning. I'm fortunate that it's part of my normal working day right now, 8 a.m. So I am in clinic right now. I am a clinician here in Nova Scotia practicing addiction medicine. My background is family medicine. Canada doesn't have a formal system of board certification, but we do have credentialing, and I am credentialed through the International Society and through the Canadian Society of Addiction Medicine. I plan to be in Marrakesh, and I look to break bread and spend time with each of you in Marrakesh if I can. I have a presentation that I'm giving, part of a panel discussion on involuntary treatment, and also a small presentation on some of the work being done in Canada on medical assistance in dying. But I really look forward to this being my first ISAM conference. I've yet to attend one. So thank you, and thank you very much for welcoming me to this table. I look forward to the work that we do together.
Thank you very much, Dave. Thank you very much for joining us. Yeah, we are really excited to have you on the board. And we can go around and ask other kind of members of the council to introduce themselves. We also basically ask members of the regional council to introduce assistants, basically next generation of people who are going to be kind of leading the society in the future. And we also kind of welcome those people who are new members in the council. And meanwhile, we also kind of ask people to, even if they like, they can have deputies to just kind of extend their regional representation. So hopefully kind of we'll have those new people on the board as well. So we can start with Wei. Wei, do you want to introduce yourself and also your assistant?
Yes, I'm Dr. Wei Hao. I'm a psychiatrist working in the Mental Health Institute, Central South University, China. My institute is also WHO Collaborating Center for Drug Abuse and Health. I'm a general psychiatrist, but my research was focused on the addiction, and I think I'm happy to work with all of you on this important area. Thank you very much.
Thank you very much, Professor Hao. Just kind of amazing to have you on board. And we have Jiang, who is one of the assistants of Dr. kind of Hao. Jiang, do you want to introduce yourself?
Of course, thank you. Hello, everyone. I'm Jiang Long. I'm a psychiatrist at Shanghai Mental Health Center, Shanghai Jiao Tong University School of Medicine. And I'm working with Professor Wei Hao, and I'm helping out with him, like some coordination for East Asia. Thank you.
Good to have you, Jiang, on the board.
Thank you.
And we can move forward and have Dr. Rabia Bilici from Istanbul.
Hi, everyone. I'm Rabia from Istanbul. I'm a psychiatrist. I'm the chair of Addiction Psychiatry Association in Turkey. We are transforming it as a foundation because we have some advantages when we became a foundation. The official processes began. Now, I think in few minutes, we will be Addiction Psychiatry Foundation, and I will be the chair of that organization. And as I said before, when I saw Hamed and his team, I always felt charged with young team. So we also recruited a team and meeting each Monday regularly. We are 10, but we are 3 here with Sümeyye and Ediz. I'd like to introduce them. Maybe they can say hi to you. It's really very nice to be with you.
That's amazing. That's amazing. Sümeyye, do you want to introduce yourself?
Yeah, sure. First of all, thank you for everyone, and especially my professors to be a part of this. And I'm a almost third year residency in Istanbul, and I have been actually really keen on addiction medicine, and it has been a great opportunity to be able to work within this field. So I'm very eager and motivated to be a part of it. Hopefully it will be a great year. That's all I can say now.
Awesome. It's great to have you, Sumaya, here. Edis, do you
Thank
want to
you.
introduce yourself?
Hello, it is Edis from Istanbul. I graduated from Hungary, from Semmelweis University, and I work as a psychiatry resident in Istanbul for a year now. Thank you for the opportunity, and thank you to Rabia for the opportunity as well. I'm very grateful and excited to be the part of this team. Thank you all.
Awesome. It's great to have you, Edis, here. We can move forward and ask Jonah to introduce herself. Jonah.
I'm Jonna Levola from Finland. I'm the regional representative for Northern Europe for about a little less than a year, I guess now. Sorry to say, I just popped in this meeting. I have to move on in a few minutes, but it's really nice to be part of this community and nice to see also new faces.
It's great to have you, Jonna, here. Thank you very much for joining us. We can move forward and have Dr. Gigenga from Argentina.
Hello to everyone. I'm a psychiatrist. Now I am a Secretary of Prevention and Addiction Assistant of the Córdoba Ministry of Health and also President of the Argentinian Society of Addiction Medicine and part of ISAM for many years. So thank you very much.
It's great to have you, Dario, here. And we can ask Professor Tarek Gawad from Egypt. Tarek, are you with us right now?
Hello, everybody. I'm Tarek
Hello,
Gawad. I'm a psychiatrist. I'm part of ISAM since its beginning, and I'm pleased to see and meet every one of you. Thank you.
Good to have you here, Tarek.
Thank you.
And Tarek has been president of ISAM. He has been involved with ISAM from the first day. So he's one of the founders of the society. And it's just great to have his support for what we are doing here right now in ISAM. Thank you very much, Tarek, for joining us.
Thank you, Hamid. Thank you.
And we have two kind of officers from ISAM Regional Council and also ISAM Gen. Fatima, do you want to introduce yourself?
This is Fatima Abou-Ghassemi. I am a medical doctor to be in a month. And it's like I'm working with Dr. Ikhtiyari for, it's been, I think, 2 or 3 years. And I'm like doing the behind the scene works. And yeah, that's all. I'm so honored to be here today. And thank you for having me.
Thank you very much for joining us, Fatima. I mean, all those emails that you receive are coming from Fatima's side. So she's doing an amazing job to make sure everything is working perfectly well. Thank you very much for joining us. Arash, do you want to say hello?
Sure. Hello, everyone. This is Arash Khojeste. I'm also an almost to be doctor, 1 month left for my studies. I'm also an MPH candidate. I've been involved with ISAM for around 3 years now. And I've been honored to work specifically within the ISAM Global Expert Network, and which we will hear more about in the meeting as well. And it's so nice to see you all here. Thank you.
Tanya.
Hi, not sure if you can see me well. Just took the risk to start my video. So good to see you all. I'm Pernian. I'm a PhD student of psychology at Trinity College Dublin, and I started working with ISAM Neuroscience Interest Group. At first started in January 2020, if I'm not wrong. And then it expanded, and then ISAM Gen was born and other committees as well. And I had the great chance to be involved in some other activities in those committees as well. And yeah, great to see you all.
Awesome. Thank you. Thank you, Panian, for joining us. And we have also Dr. Malakai Nikki from Metacognium company. We are kind of trying to develop a portal for our global expert network, and we are negotiating with different companies. And one of the companies that we are negotiating is the Metacognium company. And I asked them to basically join us to have a sense about how the global network works because of kind of some technical kind of discussions that we have to see how we can develop a portal for that. Nikki, do you want to say hello?
Hi, everyone. I'm so glad to be here and see these amazing people. I'd be really glad to help, collaborating with ISAM, and we can create a great network, kind of put everybody in touch and make it work.
Do you want to tell a little bit about yourself?
So I'm a PhD in computer science. I recently graduated, and little before that started Metacognium company working on developing apps for SUDs, kind of prevention and identification of targeted SUDs, and also working on different types of portals to kind of help for ISAM, and also kind of working on different parts of the addiction societies.
Thank you very much. Thank you very much, Nikif, for joining us. Okay, now we can move forward and I can show you the slides that we have and see how we can you see my slides?
Yes, we can.
Okay, awesome, good. So as moving forward, we have, as you know, we have 15 regions right now for ISAM Regional Council. And this is the composition of that regional council. And I'm really glad that we are basically filling the blanks that we have in the map. So we already have 13 regional representatives from different countries around the world. And I'm happy that we are welcoming some new members to the council. I'm hopeful that would be a really good global representation of people around the world that are working in the field of addiction medicine. And as we discussed today, we have Dave Martel with us from Canada, Rania from Egypt, Ayana, who's not able to join us today. Hopefully, she's trying to join us briefly from Caribbean regions in the US. Also, we have Carol from USA, and that is these are the new members, and we are hopeful they will play a significant role in extending global representation of ISAM. And as we know, the structure of global council or regional council is based on having representatives and also chairs and deputy chairs. So that is the structure of the ISAM Regional Council, and this is how it is being organized in terms of having regional representatives. We already have 4 representatives from Asia, 5 from Americas, 2 Africa, 3 Europe. And then we are hopeful to have a contact person from each country in each region. So for example, if we have 15 countries in Caribbean, each of them should have their own national contact. We call them national ambassadors. And also we are thinking that those country contact persons, they would be able to find country experts who are going to be a part of that network. And this is the structure that we are thinking about right now. And those regional representatives are being elected to serve in the regional council for 3 years. And we are hopeful that this also provides an opportunity for those people to find opportunities to apply for higher ranks in the ISAM as well. For example, as you know, we already have an opening position in the board of ISAM, so we are hopeful that these people would be able to also apply for and be a part of the leadership of ISAM in the future. And this is the structure that we already have. So the main reason that we are here today, we have something like a quarterly meetings to just get together, discuss about things that are happening in the regional council, how much progress that we have, what are the things that we have done so far, and also open the doors for interactions and discussions in terms of, okay, what are the questions that we have, especially for the new members, how things are working here, and support each other to be able to push the council forward together. This is what we have in terms of the societies that are already, addiction societies that are already working with ISAM. And these are basically the foundations of International Society for Addiction Medicine, because those societies are working with us in terms of having services and quality measures around the world in the field of addiction medicine. And we are hopeful to be able to enable other countries to have their own national societies in the field of addiction medicine and push the field forward. We have a board member, Atul, who is not today here. He has kind of a important meeting in the Ministry of Health in India, and he was not able to make it for today, but he is basically the membership officer, and he helps all those societies to be able to be a part of the ISAM society. And we are hopeful that regional representatives, for example, as we have Rania right now, who is representing North Africa and West Africa, she would be able to kind of help other countries that they already do not have active societies to kind of start to establish their own societies. Or even if they do not have the societies, they have the national experts and national ambassadors to be connected to ISAM to have a representation in ISAM. But we are hopeful that this map is going to be extended around the world, and we have more active societies around the world to work with ISAM. One of the other activities that we do in ISAM, we try to develop work groups and kind of bring experts together and see how we might be able to kind of answer some of the challenges that addiction medicine is facing around the world. And one of those kind of structures that we have for those working groups is what we call ISAM Global Expert Network. In the ISAM Global Expert Network, we usually kind of run surveys. For example, this is one of the surveys that we are working on opioids and how opioid treatments are being organized around the world. This is kind of the initial representation of the societies that attended that specific global survey. And in the next follow-up, we have been able to kind of recruit more societies. And this is the structure of the societies that contributed to that global expert network survey about addiction treatment services for opioid use disorder. And we are hopeful to also include few other countries in that map as well in the future. But this is how kind of the system works. And I'm happy that we have Arash here today, who is going to just give us a really brief overview about what we have done for that global survey, to have a sense about how these sort of global surveys work and how our regional council members are able to contribute in these surveys and also play an active role in terms of making sure that other countries in the region would be able to be representing in those surveys. Arash, do you want to go ahead?
Sure, thank you. So this is Arash again from the ISAM Gen Assistant Officers team. Thank you, Hamid, for the introduction. So as you all know now, it has been a while that we have been working together within the group of ISAM Global Expert Network around the world, as you can see in this slide. So since we are short in time, I'm going to skip the more detailed introduction to ISAM Gen and kindly ask my colleague Fatima to share some useful links with you in the chat space. Next slide, please. So one of the important steps we took was running a pilot survey on treatment service provision for opioid use disorders with gathering global data on available treatments, harm reduction programs, and opioid varieties as our initial survey within this structure of ISAM Global Expert Network. Next slide, please. So with regard to levels of involvement within the ISAM Gen platform, for this specific survey, we chose the addiction societies and individual experts and treatment centers between those. So mostly due to the more available variety of the involving countries at the time of starting the project. Next, please. So overall, we were gladly able to have the involvement of 43 addiction and medicine societies representing 40 countries around the world, containing 15 in Europe, 15 in Asia and Oceania, 6 in North and South America, and 4 in Africa. We were able to reach to a 93% response rate of the invited societies to participate in this survey after several rounds of reminders. Next, please. So moving forward to some of the results, our findings showed prescription opioids and heroin have been reported to be the most used opioids in general, while tramadol and codeine are the most reported within the group of prescription opioids itself. Our data shows that the variety of different prescription opioids are more significant in North America and Oceania, while China has also reported most of the prescription opioids being widely available for non-medical use. Next slide, please. So moving forward to the next section on available treatment facilities, it appears that community level outpatient clinics are the most used treatment setting in the context of opioid use disorders. Shelters are also reported to be among the least settings available, especially between our African and Australian respondents. So regarding the treatment types, short-term inpatient withdrawal, self-help groups, and opioid maintenance therapy with methadone are among the most reportedly available. This is while the variety of treatment types are much less in the African and South American respondent societies. Next, please. Regarding the available medication types, most of the respondents have basically reported methadone and buprenorphine available in their countries, while other types of medications such as slow-release oral morphine and heroin are mostly seen to be used in some of the European countries and Canada. And following that, motivational interviewing, CBT, and family therapy are among the most popular psychosocial interventions for opioid use disorders, according to the responses we have received. Regarding the 12-step programs, it seems to be limitedly available between our African, Asian, and some of the European respondents, while in North American countries in Oceania, 12-steps programs are reported to be available almost nationwide. Now moving to the harm reduction services, it appears that almost all of the European and South American and the Oceanian countries have health system supports for almost all patients on hepatitis and HIV treatment programs. This is while the rest of the respondents have also reported the available support for their patients, but in somehow a lower extent. And here in this slide, you can see that HIV testing, antiretroviral therapy, TB and STI diagnosis and treatment, and HPV vaccination seems to be all available across the respondent countries. The varieties of available settings for harm reduction services are basically seen to be more available in European countries and North America and Australia. Most reported available settings for harm reduction services are treatment centers as inpatient units. Next, please. So after this brief look into our results, we are thinking now we are actually standing at the point of reaching out to the societies again in order to ask for their interpretation and thoughts on different aspects regarding the survey results. This will add much more value on what we have already aimed to receive within the ISAM Global Expert Network, and it will be in line with the aims and visions of the network.
Thank you very much, Arash.
Yeah.
One thing that might be helpful to discuss, we are putting together a report from that overview about what are the treatment services available around the world for opioid addiction. And we have already started to kind of discuss and plan for writing a paper and asking members from the council, from different kind of regional representation, also countries, to write a short piece about the available treatment services for opioid use disorder in corresponding countries around the world. And we are hopeful to be able to put that together, some like a global report of opioid use disorder treatment services around the world and the lacks and limitations that we have around the world. And we realize that, I mean, there is nothing like that in terms of kind of providing an overview of what is happening around the world. So these are the kind of sort of sample activities that ISAM can do and the regional council can contribute to those discussions. Anything else that Arash, do you want to add?
No, I just wanted to add to this about this slide that we are also working on some other surveys, upcoming surveys on PTSD and substance use disorder and dual diagnosis, and we are forming working groups, and we are aiming to target individual experts in these specific surveys after we targeted societies and associations in the first survey, the opioid survey, which you already heard about the results. And we are looking forward to have more experts in the network. We have also the QR code. If you're not already in our database, you can scan the QR code and fill out the form, and we will be in touch with you and let you know when we are starting to have our further surveys.
Awesome. Thank you. Thank you, Arash. As you can see here in this map, this is the kind of the global representation of the experts that we already have in the database of experts. and also societies. The blue colors represent societies that we have from different countries that are involved with ISAM. So as you can see here, that is kind of the global representation of the countries that are actively involved with ISAM. But as you can see, there are still many gaps in different parts of the world that we are trying to address with activities of regional representatives that we already have on board here. Alex.
Just an observation. I think you've already used it as part of your methodology for recruitment, is that the regional representatives were involved, particularly around the region, in order to recruit members, experts within particular countries who might not have been responding or who, are taking too long to. I think you've used no regional representatives for that.
Absolutely, and we'll discuss how much progress that we have made so far. So that will be another part of discussion that we'll have today. So hopefully we will be able to push that forward. And we have Dario, who is one of the champions of making that happen in terms of bringing experts from multiple different countries in South America. Dario, do you want to kind of move forward and kind of present what you have?
Okay, thank you very much. Actually, we have a huge number of physicians in our region, but as you know, we are some kind of isolated in our continent in some way, for the distance or whatever. But this is a real opportunity to involve them to this great network that ISAM is. So this is the action plan of this year. We will have a meeting right now in Córdoba in a few days, the Congress of Addictions in Córdoba, with the presence of some representatives of the South American region of ISAM, and Ivan Montoya of NIDA too, and the head of demand reduction of the Organization of American States. That is an opportunity. There we will have an ISAP, the International Society of Substance Abuse Professional meeting, with the presence of the Vice President of ISAP too. We have also summoned the national ambassadors and a list of national experts for each country, as you can see, to be part of ISAM Gen, Argentina, Brazil, and in Brazil, we will have an ISAM meeting, official ISAM regional meeting in September. I will be there too, organized by Alessandra Dil, who is the ambassador of Brazil. And next, please. The new ambassadors are from Chile, Carlos Ibáñez, and he recruited 13 national experts, and Pablo Fielis from Uruguay. He is the head of the Faculty of Medicine of the Republic of Uruguay, with 11 national experts. From Peru, Alicia Chu, she's the president of the Peruvian Society of Addictionology, with 9 national experts, and Dr. Rodrigo Cordova, who was very active, helping me to spread the network in South America, because he was the past president of the Latin American Psychiatric Association, and currently is part of the board of the WPA, probably the South region, with 9 national experts from Colombia. And the last slide, myself in Argentina, Bolivia, Guillermo Rivera, past president of Bolivian Psychiatric Association, and Brazil, Alexandra Dil, from the Brazilian Association of Studies in Alcohol and Drug Studies, with 10 national experts. And Ecuador, Sergio Paz, he is part of the staff of Psychiatric Hospital in Ecuador, with 10 national experts proposed, and from Paraguay, Miguel Cuellar. That is the my proposal for national experts and ambassadors from the region. I hope we can contribute for the great idea to have studies with this new methodology. For me, at least, that is the expert consensus or expert elicit methodology. Thank you very much to all of
Awesome.
you.
Thank you, Dario. It's just amazing to see how actively Dario is able to engage multiple kind of experts around the region. And what we did, we invited those people officially to the network. We sent them some initial qualification kind of surveys, making sure that they fulfill the criteria that we have and include them in the process. So we are working with these kind of new introduced members to the global expert network that we have. That is really inspiring. Rabia.
Hi again. It's really hard to present after Dario. When I received your email, when I saw Dario's Excel form, I said, "Oh my God, what will we do now?" To tell the truth, we were trying to present the list on Marrakesh. So this meeting was a kind of surprise for us. So when we received your email, we tried to be in rush. And next, please. First, I'd like to share that it's not easy trying to reach by web addresses. You will see my colleagues try to reach the addresses of some organization in different countries. We sent emails, but most of them didn't respond it, or some of the email addresses were wrong. So we thought that it is not a good idea to search the addresses on web and write them. So I wanted to share it for my other colleagues to not to use this way. The other one, please. And this is the same. Yes, we tried to reach. And now maybe for 2 weeks, we tried to reach some colleagues from other countries by snowball method. And there are still some countries that we didn't reach even single one person. One is Belarus, Moldova, Bosnia, Montenegro, and North Macedonia. Then we will try to find a way to, there's the ISAP website. We had a research search on it, and we tried to find some colleagues from ISAP. We are also ISAP members, and maybe find someone and then go on. This is our work just for maybe 2-3 weeks. And the next one, please. And we were mostly working on the ISAM regional conference in Turkey. I hope the board of directors in ISAM will accept our request and we can do it. I believe that because we can reach more people if there's a meeting in person. And I will be in Marrakesh also. I will try to connect people there. I think the good idea is trying to reach people in person or also by snowball method with some colleagues. That was our presentation. Thank you.
That is amazing. Thank you very much, Rabia, for presenting this. Alex, do you have a question?
Yes, an observation. It's, this is hard work, and in a way that is the reason why there isn't so much clarity, and different regions have different challenges. Rabbi, I would suggest rather than just using the ISSUP, I think you'll get better mileage if you connect with the Europed, which is an ISAM affiliated organization, and the UFAS organization. If you don't have the email address, I'm more than happy, Marilyn from the ISAM office as well. And they have links of addiction medicine specialists throughout the region, especially in your region.
Okay.
They're very active in Europe, for example.
Thank you very much. And maybe I
okay.
see UDDR, Alex, because when we reach some colleagues, they say that we are not medical doctors. We are because we
Yes.
are mostly looking for medical doctors or psychiatrists.
Yes,
for
that's
example,
why.
Yeah. Okay.
That's
thank
why
you
I
so
mentioned
much.
it. Yeah.
Thank you very much. Okay.
Awesome. Good. The next one is going to be Sophia Ashap. Sophia, are you with us right now?
Yes, I'm with you. Do you hear me?
We can hear you really well. Yes.
Yes. Super, perfect. Sorry, very sorry for being late. Had to deal with the clinical issue, unexpected clinical issues. Sorry, very sorry for that. I have an issue as well with the camera. I don't know why. It was working at the very beginning. Sorry, you cannot see me, but the heart is there. So in the European region, in the Western and South European region, I will be presenting some of our achievements according to the goals for the previous period, and then the plans that we have. Next, please. The achievements that we made in Q2 and Q3 was the publishing of in June of the chapter on Europe that I've written on women and addictive behaviors in the collaborative book led by Fulvia Prever and other colleagues. The scientific symposium organized by the French Federation of Addiction took place in June, where I've given a talk under invitation of Michael Bish, which I thank a lot. And lastly, the joint book chapter that I invited IFAC, from France, from Nantes, Marie Graal-Bronek, to contribute in writing gaming disorder management for the Swiss Medical Review that I have edited. We've written it together, and it was submitted, and it is planned to be published in fall 2023. Next, please. At a global level, global and European level, in the same period, so there was the World Health Organization FADAB organized in June, where I've given a talk in a parallel session on addictive behaviors. And I took the opportunity as well for ISAM to network with Spanish Ministry of Health to see how they can be involved in ISAM activities. And following that, I've had discussion with them, and I could appoint a national ambassador for first time in Spain. Then we've worked together with Roshan in promoting and Jiang present there to promote ISAM Next activities. And lastly, I've took the opportunity to network with a person from Pompidou Group who reached out to me, discussing future plans on setting in a European expert group to work on the recommendations for the countries on gaming disorder and tech use, which doesn't exist until now. The second great achievement was at the global level, European level, was that I've been appointed Impact Advisory Board member for Horizon Europe Bootstrap, the project which is funded by Europe and led by Naomi Feinberg on tech use of youth in order to achieve actions and to build guidelines for countries afterwards. I've chaired the kickoff meeting session for the Impact Advisory Board. This was in July, and I wrote the report accordingly. And the last great points that we've had during the period is that I'm part of the World Health Organization Pan-European Mental Health Coalition, more precisely on two working packages, one on children, adolescent and youth mental health, and the other one on leadership in mental health. And the most important thing which is ongoing, even if it is confidential, is that I have the pleasure to be appointed as expert in August to be part of the working group on developing recommendations for countries regarding the child, adolescent, and youth mental health, more precisely in involving youth in mental health policy making and planning. Next, please. In terms of societies in Europe and other continents, successful appointment of 5 new national ambassadors. I've talked about the Spanish one, but we've had as well Henrietta Bowden-Jones, the very esteemed colleague, having accepted to be the national ambassador for UK. Emiliano Scafato, as well, an eminent expert, has accepted to act as national ambassador for Italy. Zol Dimitrovic for Gibraltar, and for Monaco, I've reached out to the head of the addiction division of Hôpital Princesse Grace, and he is under our, he's very happy to respond to any needs regarding being national ambassador for Monaco. I will follow my work involving you national ambassadors later, but I will speak about it in my plans. No, stay please in the previous slide. Yes, with other societies around the globe, with California Society of Addiction Medicine, last year, if you remember, I gave a teaching for them in their annual meeting in 2022, and after that, one of the board members of the society reached out to me this year to organize a visit in Switzerland for benchmarking reasons in addiction medicine, and we are going to organize that in 2024. And the last part of the achievements in Europe and other continents was that I have the pleasure to be appointed Lancet Psy Commission under invitation from Zolt, Naum, Finberg, and Denstein on problematic internet use, and this was in May 2023. Next, please. My plans, next plans is the first one is ICBA annual meeting in Seoul, where I will be part of World Health Organization symposium, giving a talk on the health systems in Switzerland dealing with gaming disorder, and another symposium on gender issues with Asian and Australian expert colleagues. And this is in August 2023, in late this month. And of course, our ISAM annual meeting in Marrakesh in November 2023, my home country. I've been invited as a keynote speaker, and I will be speaking there with a lot of emotion and a lot of pleasure. I will continue enrolling national ambassadors in Europe just to fit with the requirement of my 18 countries under my responsibility. And I will work with these national ambassadors in setting. They will propose the experts from their countries, and we will organize a meeting when I have all the national ambassadors completed to collect as well the country's needs in terms of training, research, and the topics that I will be willing to work on with national ambassadors and experts in my sub-region is addictive behaviors, of course, my area of expertise, and the tobacco and youth mental health. Next, please. Thank you.
Thank you very much, Sophia. Just impressive amount of work that you have done, and hopefully you will have a really good representation from West Europe that you are leading. Yona, are you with us?
I think she may have left. She communicated in the chat that she needed to move on.
Okay, good. And Yona provided us with kind of some slides in terms of the progress that they made in North Europe area, and they are actively kind of working with different members of that community. Hopefully we'll have national ambassadors and individual experts from that part of the world as well, and they are making lots of really good progress on that direction. So I'm really happy and excited that that is moving forward really well in North Europe. And then we have Dr. Solomon Ratamane, and Soli had an issue. It seems that he kind of faced a challenge and he was not able to make it, and also Dr. Goodman Zipko, and he wasn't also able to make it for today, but they are working to make sure that we'll have representations from Sub-Saharan Africa and kind of South Africa. Hopefully we'll have active contribution from that part of the board as well. Same issue with Offering. Offering is actively kind of recruiting people from Central Asia, and hopefully we'll have some updates from Offering as well. And now Professor Wei Hao. Wei, are you with us? Are you presenting, or Jiang is going to present?
Jiang will present.
Awesome. Good.
our
Jiang, go
work.
ahead.
Okay, so in the next few months, we have worked on a network in East Asia. In our region, we have 5 countries, including I think 8 jurisdictions. For China, we finished our recruitment for national experts. We have experts from different regions in the country, including Shanghai, Hunan province, east, west, and the north and south. So very good. But we need to work on national experts from Hong Kong, from Macau, SAR, and also Taiwan province in the next few months. And then next, please.
One thing that might be kind of helpful to kind of even discuss further in the future as well, for countries like kind of China, US, Canada, India, which are basically huge countries, that might be a good idea to have kind of to divide them into different provinces and states, and having representing members from those pieces. So that is what you are doing in terms of kind of having representations from different parts of the kind of China, and that is probably a good idea to do for countries that are kind of divided into different kind of provinces or states. That might give us probably a better representation in the global level.
Yes,
So
yes,
yeah,
exactly.
that would
Yeah,
be something
exactly,
we can
Hamad.
discuss with Carol and Dave as well in the future.
Yes, yes. And we will continue working on that and have more national experts from different regions in the country as well. Yeah, especially we have several jurisdictions. And then for Japan, we also finished recruitment. We have 10 experts from Japan. And next, please. Then we have South Korea. We are working on that as well, because now we only have 3. It's a little bit tricky to get experts in the country, but we will continue working on that. And next, please. And we also finished recruitment from Mongolia, and we now have like 10 experts from the country. And the only country which is, I should say, extremely difficult for us is North Korea. It's like very hard to get any expert from the country. And we will continue working on that, but we cannot guarantee we can get national experts from North Korea. And also in the past few months, I did not put it into the slides, but we all, I mean, Professor Wei Hao and I and other Chinese colleagues, we went to the WHO headquarters in Geneva in July and June and July. We participated FEDEB 4, and we met many experts. I mean, including some experts at our meeting. So we discussed many topics in addiction medicine, and also, I mean, in November this year, we will have in our country CADEP, Chinese Association for Addiction Treatment and Prevention and Treatment. We are going to have like annual meeting in our country. We would like to utilize this platform to promote ISAM's work, and also, try to include more experts from different regions in the country. Thank you very much. I think that's all from China.
That is impressive. Wei.
Yes, thank you. I personally, I would like to host a ISAM meeting in China if possible. Is that possible? This will be our hope. Number 1. Number 2, just for your information, WHO will will have a WHO meeting in postgraduate education and training in the addictive disorder to be held in China, my city, Changsha, China. And some expert from different countries will be invited to join the WHO expert meeting, and also some international organizations such as World Psychiatric Association and ISAM were invited to join this very important meeting. I just for information, I hope our colleague here in ISAM can join us. Thank you.
Rania.
Yes, Dr. Hamid, I'm wondering, did my slides arrive? Because I received the mail to put the slides yesterday night, 9 p.m. So I sent it this morning. Did it arrive?
I think we do not have your slides here, but we can give you kind of your screen to be able to share your slides. So we will definitely make sure that we will do that. Alex.
Yeah, this is an important point that our Chinese delegates are putting forward. I think, you know, I'm not sure if you're all aware, but we have an ISAM Bites. So ISAM members and affiliated societies receive every fortnight a newsletter, really, we call it ISAM Bites, where we would announce, you know, meetings on a local, regional, not necessarily ISAM or, you know, ISAM focused, but any meetings that we feel are important to circulate to our potential audience. So please do feel comfortable to get in touch with the ISAM office and share the information that you're providing. And the other thing is there are two possibilities of either organizing a regional meeting, if it is China, will be an Asian regional meeting, or if you're ambitious and mad enough to organize an international Congress, and that needs a lot of planning. I mean, the application needs to go at least 3 years before the actual event. The regional is usually a year before, and even that there's a couple of meetings around deciding what the ideal date is. So the one that Rabia had mentioned would be our first European regional meeting, and what Dario had mentioned in Brazil would be our third. Is it third South American? Second South American, third South American regional Spanish-speaking meeting. So there's different variations of it, and it's about, you know, sending an email or a formal letter to myself in this case and the future ISAM president in order to then start the processes. Thank you.
Thank you,
Yeah.
Alex.
Yeah, that would be awesome to have one of the ISAM international meetings in China. That would definitely be a great progress moving forward for that. Rania, you can share your slides and your screen if you want to share your screen, if that works, or otherwise you can just present without your slides.
I just forwarded Rania's slide.
Okay, so let me, if I can download them now, I can. Okay.
So I stop sharing.
Yeah, I can. Let me just kind of. Yeah, okay. I'm downloading your slides. I'm putting your slides here, and I'm just showing your slides in a second. Here we go. And Rania is going to be the last speaker for today. So Rania is going to give an overview about what she's doing, and we'll have probably kind of a little bit of time at the end to just answer questions and be hopeful that other new regional representatives will have the same sort of presentations in the next meeting that we are planning for October. So we'll send you kind of probably a pool, or we can discuss about the timing, but we are planning to have a meeting in October, same time, to just make sure that everybody will be able to attend. Rania, please move forward. You are on mute, Rania, we cannot hear you.
Thank you, Dr. Hamid. Can we have the next slide, please?
Yes.
Yes, the Northwest Africa region is complied for 15 countries in the region. We reached for the last 2 months to reach our colleagues in 8 countries, Egypt, and we arrived to having 8 ambassadors to each country, with these coming numbers of experts in each country. So now we have an ambassador from Egypt, Libya, Sudan, Morocco, Mauritania, Nigeria, Cote d'Ivoire, and Sierra Leone. With the 8 ambassadors, I'll be sending you tomorrow the list, just like the list of Mario. Thank you very much for sending me. So I'll make an exact one like this one. And we reached about 36 experts from Egypt, another 4 experts from Libya, another 4 from Sudan, 5 experts from Morocco, and 2 experts from Mauritania, 10 experts from Nigeria, 2 from Cote d'Ivoire, and another 2 from Sierra Leone. And I would love to thank very much my colleagues in Sudan and Libya, although the inner conflicts in their countries, but they are highly enthusiastic and encouraged to be with us. Next slide, please. Societies now, I contacted the Central Egyptian Society for Combating Drugs and Addiction Medicine, and the Moroccan Society for Addiction Medicine, and the Nigerian Sound Mind University Society for Addiction Treatments. They're taking the approvals of joining the ISAM body, and I discussed with them the kinds of collaboration could be done and the kind of benefit for the ISAM and for those associations in reaching more addiction medical professionals. Next slide. Regarding the memberships, all ambassadors that I met, in order to increase the memberships, the individual members in ISAM, I talked personally during the online and hybrid meeting that was in Cairo, 19 June in Cairo, and I attended another meeting last month in Johannesburg, and the ICU-DDR conference in Thailand 2 days ago, and I discussed with the 8 countries I could reach about raising memberships, the amount of payment they have to do, and invitation to share with us and participate in the next Morocco annual Congress. We're now trying to raise funds for 6 of our colleagues in Sierra Leone, Nigeria, and Morocco and Egypt to come to Marrakesh next November. The activities that were implemented in the last 2 months, the Cairo University Scientific Day, this was a one-day scientific with 9 speakers, 4 from the US, another 5 from Cairo University. It was on the World International Day Against Substance Use and Illicit Trafficking. This was an in-person and hybrid scientific day where 140 persons came to the scientific day in Cairo University, and another 249 attendants were attending online from the whole African continent, not only North and West Africa, and also we have our colleagues from Europe and the US and other colleagues from the Middle East and East Asia. Next activity was an Africa webinar. No, back to, yes. Another activity was an African webinar on the multidisciplinary approach in addiction medicine. It was done on the 3rd of June. About 76 colleagues from Africa attended, with 4 speakers, 3 from Cairo University and another colleague speaker from Libya, Bani Ghazi University. We discussed why it is important to have a multidisciplinary approach among the addiction professionals dealing with substance use patients. This webinar was for 1.5 hours and it was recorded. Then the link was sent for the whole region. Another activity was that 5 psychiatrists, Professor Tariq Abdelgawad, our professor from Cairo University, succeeded to let 5 addiction professional physicians from Cairo to enter the ISAM exam early this year. Next slide, please. What we suggest at the Northwest Africa region for the future activities, that we agreed about a collaborative research between Egypt, Libya, Sudan, and Nigeria on the educational needs assessment in addiction medicine. We will make a needs assessment survey And we had the ethical and scientific committee approvals from Cairo University. Currently, we are going with the approvals from ethical and scientific committees in Jos University in Nigeria and Bani Ghazi University from Libya. It will be a preliminary step for a universal addiction curriculum for North and West Africa, because still there are universities in those countries that do not have an addiction curriculum in the medical school. Next, we are proposing an ISAM regional conference in gathering the colleagues from North, West Africa and the Middle East. We suggest that this regional conference would be in February in Cairo, in coordinates with our international annual congress in Cairo University. And we propose that we could be hybrid, so all the other regions in ISAM could attend with us and in person. We are trying to raise funds for our colleagues in the region to attend this regional conference. We are suggesting also an online addiction medicine course for 1 year. It will be online to prepare the region young psychiatrists and physicians from public health for the next ISAM exam. We are now gathering who can be the experts, trainers and speakers that could be fidel with us and committed with us for 1 year to have the curriculum or the addiction course online for the young psychiatrist. Next, thank you so much.
Awesome. Thank you very much, Rania. Just impressive amount of achievements that you have done in a short period of time that you started as the regional representative in North Africa. That is really impressive. Alex.
Yeah, can I repeat that, Rania, considering that you've just started and presenting all that, this is really, really impressive. And I'm sure you have a fantastic mentor called Tarek Gawad there behind you. A couple of things. I think it's also, as much as, use the education assessment, the needs assessment, it would be really helpful, Rania, if you connect with the education committee, with Shalini, who I know from the ISAM education committee, who have already done a survey like this, and also the ISAM Next, who have done a similar but slightly different survey. But I think both might be really helpful to consolidate what you intend to do. And the other thing is, if you're seriously thinking of organizing a regional conference, if you can send me an email or the ISAM office an email so that I can put it forward to the ISAM board of directors in Marrakesh so that you get the right approval and support, considering the fact that you're thinking of organizing it in February of next year in Cairo. Looking forward to that. Thank you very much. Very impressive, Ran.
Thank you so much.
Great. So that was kind of the presentations that we had. And if you have any questions, anything else that people are interested to discuss about, and kind of especially with the kind of new members, Carol and Dave, who are here. Carol, what is your feeling after kind of receiving those presentations?
Now is the time to resign. No, I think.
Right. I'm sorry you're asking me. You're reading my mind through the Zoom. Very, very impressed, very overwhelmed, but excited to start to dig in.
Awesome. Dave.
My only question is, presumably each of you has a team of 20 people and a budget of $30,000, $40,000 to do each of these things. I'm wondering if that's true.
Oh yeah, the virtual ones. Yeah.
Yep. Yeah, you will receive the check of your budget for this year soon. So just wait for the check. So. Awesome. Greg, do you have anything to conclude?
Yes, I know there are some questions about whether we're going to be meeting in Marrakesh, and it's come up from some of the representatives. So are we planning to meet in Marrakesh, and when? I know that some people are making their travel arrangements right now. So usually we
are.
Yeah, usually we have a meeting right before at the day of the board meeting, or tell me what our plans are.
Yeah, the plan, I mean, we have what we call kind of General Assembly of Addiction Medicine Societies. So we invite all the leadership members of the addiction medicine societies who are attending Marrakesh meeting to get together. And this is what we did in Malta as well. So it was the day before the conference. We haven't concluded about the calendar yet with the local organizing committee, and we are working on that. Hopefully, we will update you very soon within the next coming days to let you, if you want to plan, and not only you, but also kind of the addiction medicine societies. And that is a great kind of networking opportunity. Meanwhile, we have been kind of receiving feedbacks that it might be a good idea to have one of the general assemblies, maybe even online. So we are still working on that in terms of how many people who are able to attend in Marrakesh and how we can put that together. So you will definitely be informed about that very soon.
Okay, so probably though the day before, that would be November 1st, like we had last year. We would get together. How many are going to be there in person raise your hand if you're going to be there in person in Marrakesh. So we've got a number. Okay, good. Well, that's very good. Okay, looking forward to seeing you there.
Awesome. Carol, you have a question?
Yeah, well, just a quick question. I received a document yesterday with a list of names from the U.S. I was wondering who compiled that and what that are those potential ambassadors or those ISAM members or who I should ask offline?
I mean, those people that we shared with you are people who have been working with ISAM in global expert network activities, the global surveys that we have been running. We probably need to have a meeting together and discuss how we are going to plan for what we can do in USA and Canada, because there is kind of an idea in terms of if we can have representatives from each state or provinces, or is it going to be too much? So we can discuss how to organize the activities within the USA and Canada. And we probably can kind of arrange something with other active members, I mean, US-based members of the board of directors of ISAM to see how we are going to plan to extend our activities with Beat USA. So we definitely have Greg and Mark kind of in a meeting discussing how we might be able to arrange our activities around kind of USA. So that is going to be something that we will plan in coming weeks, and we'll keep you updated about that. And the same for Dave, yeah. Please
put in a vote if we are going to be meeting as regional council on Wednesday, the 1st. If it could be in the afternoon as opposed to the morning, that would be helpful. But if not, we'll make I'll make my flag accordingly.
We'll see how we can. Oh, so you are going to so you'll arrive in the morning of Wednesday.
Well, my current flight is arriving Wednesday evening, but I'll switch that to the morning if possible.
Okay, so we'll definitely keep you updated about that. We usually kind of do that in the afternoon time on the day before, and we'll have some like a dinner together at the end before the actual conference. But there is an option to do it in the first day of the conference, because there might be issues in kind of finding a place, and also it will be overlapping with the board. Alex.
Hamid, I think you need to clarify, please, because I'm very conscious, like Gregory, Tarek, yourself, will be within the board of directors meeting, so you don't want these things to clash as what happened last year in Malta. So I think if you urgently clarify with Fatima and the local organizing.
Absolutely. That is the plan. One option would be just having that in the first day of the conference. So something like a 2-hour session the first day to make it kind of probably easier for everyone to attend. So that might be an option, but we'll see how we can kind of organize that. Okay, so Mark, do you have any concluding points?
I think it's really outstanding, all of the work that people, the work that's being done by people all across the globe. Really impressive work, and really looking forward to meeting up in Marrakesh and moving things forward.
Absolutely. And Rania, I can see your hands. Do you have any question, any points?
You're on mute.
Rania.
Me? No, thank you.
Your hand is kind of
chat.
Okay, good. So Tarek, do you have any concluding points?
Thank you, Hamid. I'm really very glad. One of my dreams more than 15 years ago is to see this meeting. So it is becoming true, and thank you for your really very hard working doing that. Just to a bit of correction, 25 Egyptians sat for ISAM exam. 20 of them took the exam early this year. 16 of them passed. The other 5 were take the exam during ISAM conference. So I believe with all of you, hopefully others to join in the very near future, this will really assert the role of physician, psychiatrist in the combating of this illness and the fights that we are all about. And I wish you all the best. Thank you.
Thank you, Tarek. Thank you very much. And last concluding points by Alex, our president.
What can I say? I think, facts speak for themselves. And this is really, classic example. ISAM has a great future. And with you guys, you're the leadership that will, bring ISAM forward for the next 25 years. So thank you very much. And looking forward to seeing you in Marrakesh, face to face.
Awesome. So thank you very much, everybody. So we are planning to have another kind of quarterly meeting for the fall on probably October 10th. So we'll send kind of the plans for that. So it's going to be Tuesday, same time on October 10th. Just make sure that we have everybody on board, and we'll have the same sort of process, asking people to kind of report what they have done so far and discuss about the progress that we can make. So we'll hopefully meet each other before Marrakesh online and hopefully in person in Marrakesh. Thank you very much for joining us. Hopefully we'll be able to get together and kind of push things forward around the world. Have a nice day.
Thank you for great leadership.
Thank you very much.
Thank you.
Great to see you.
Bye.
Bye-bye.
Thank you.
Bye.